across all 4 boroughs of NELFT, so that's Waltham Forest, Havering, Barking and Dagenham and Redbridge. I do dementia assessments. So I will, so I'm here to talk a little bit about dementia and learning disabilities, and how the current environment may be affecting people with learning disabilities and dementia at the moment. Okay. Okay. So I'll start by talking about what dementia is. Dementia is an umbrella term for many different types of progression in cognition. The most simple explanation is it's a decline in cognitive abilities that is continuous. In the normal population, this occurs in 1 in 20 people over 65. So people with learning disability are thought to be more at risk of dementia, and it's shown that people with Down syndrome in particular, 1 in 50 of those aged 30 to 39 can develop dementia, 1 in 10 when they're aged 40 to 49, 1 in 3 in ages 50 to 59, and more than half of those who live to over 60 can develop dementia in those with Down syndrome. Also, people with learning disabilities that have other conditions or do not have Down syndrome have a higher risk. So 1 in 10 of those aged 50 to 65, 1 in 7 of those aged 65 to 75, and 1 in 4 in those aged 75 to 85. And nearly 3/4 of those 85 and over. So both of these are very much higher prevalence than those in the mainstream develop dementia. So I'm just going to go through a few of the signs of people of having dementia. So people with learning disability can show different symptoms of dementia than those in the mainstream. So here are a few things, like an increase in challenging behaviour, showing difficulty with short-term memory, vocabulary, and praxis, which is a sort of hand-eye coordination, withdrawal from activities, being less communicative, they can be more aggressive, and also a late onset of epilepsy can occur in people with Down syndrome. And there's many other features that that could present due to individual differences of people with learning disabilities. There are other things that can cause a decline in a person with learning disabilities that might not necessarily be dementia. And these things can be a change in environment, moving home, or a change in routine, or a lack of stimulation. So if those things happen, bereavement, especially the loss of a main carer, trauma, abuse, other mental health problems, pain, infection such as a urinary tract infection or chest infection, a deterioration in eyesight, or other health problems. All of these can cause problems that can be seem very much like dementia. And in the learning disability population, in most of us, these things will cause some temporary difficulties, maybe affect our memory, but for people with learning disabilities, that effect is exaggerated and can look a lot like dementia. So right now, we're seeing a lot of these things that I've mentioned in that slide, like lack of stimulation and loss and trauma responses, which can also be making changes, giving difficulty in orientation to the people with learning disabilities, and this lack of stimulation and change in routine can also be speeding up the decline of people who have learning disabilities and dementia. So for those with LD who are diagnosed with dementia, they may be showing increased decline of their abilities due to the change in routine and lack of stimulation. So what we are doing at the moment is, for those who already have dementia or are on the list to be assessed because there's a concern, we're giving welfare checks, welfare check-ins, and by myself or other members of the team. And this will find if our clients are having difficulties in lockdown, if any deterioration is occurring. These webinars are being developed to keep staff informed, and there's activity videos being released by One Forest Disabilities team, and they might be quite useful for keeping our service users stimulated, whether they have dementia or not. And here's the link if you wanted to access those. So what can help? So I'd say encouraging people with learning disability and learning disability and dementia continue to take part in enjoyable activity. And that activity has to be enjoyable for the person, otherwise it's counterproductive and can cause stress. If it's not enjoyable, that might then cause a decline in functioning. So as before, if somebody is stressed, that affects your nervous system and your ability to think. Encouraging good mental health and well-being, suggested that has been presented in the previous presentations. Yeah, again, being calm and feeling in that safe state, having those mindfulness and relaxations go a long way to keeping someone slowing down decline in dementia. Walks and exercise are also well researched and found to help slow down the progress of dementia. And also I'd ask to continue monitor the person with dementia or those referred for an assessment. If there's a change in eating observed, such as needing smaller chunks or softer consistencies, or if the person coughs or struggles to swallow, that needs to be reported to our team immediately, as those with dementia are at high risks of developing something called dysphagia. If you're interested in more information on dysphagia, that's going to be presented on Friday the 29th in another webinar. Report to your community learning disabilities team if there's anything else concerning, such as a great change in abilities or an increase in behaviours of concern, so the team can provide the support you need. So I'm going to talk a bit about behaviours in dementia, because that is maybe something else you might need a bit of support with. So a decline in functioning can lead to a reduction in ability called perception. This alters the way people with dementia see things. This can result in the client reacting in certain ways. For example, objects which are black could be perceived as a whole. Therefore, if the seat of a car or some furniture is black, the person might think you're trying to make them go into a hole. Also, blue objects could be perceived as water. Imagine how you would react if you thought someone was trying to push you into a hole or some water. So that, that you might get some aggression, they might be pushing back, they might refuse to do what you're trying to get them to do. And this might be simply because their perception of things have changed. More behaviours are problems can also be caused if things in a room are the same colour. And that makes a person with dementia difficult to see things. For example, if a bathroom was white with white walls and a white toilet and bath, it'd be difficult for the person to actually see those separate things, which might lead them to refuse to use them. A reduction in functional ability can also cause frustration, which might present as anger and aggression. So if a person's sort of lost the ability to do something they really liked doing, then that could be quite upsetting and lead to anger, aggression, a feeling of loss. A decrease in communication might also increase behaviours, as they might be losing the ability to communicate their needs or pain. As you may be aware that some people with LD may have behaviours which have been present for most of their lives. In this case, a decline in their function might result in an increase in the intensity of those behaviours, or an increase in frequency. So what can help in regards to the environment and people with dementia reacting to certain colours? There's simple things that can be done. So putting a red throw over any black furniture or car seat, putting a bath towel over the edge of the bath, or a seat cover on the toilet. If an area in a room causes distress to that person, you could just avoid that area until that environment can be changed. Other behaviours might need to be discussed with us because of all the different individual differences. We might need a little bit more information to figure out what could help in those situations. Even so, in these instances, you can refer to the Disabilities team. And there's going to be webinars on managing behaviours challenge that will be held next week that could give you some more tips on dealing with behaviour if the person has dementia or not. So another thing that we use to sort of help dementia to slow down the progression is called cognitive stimulation therapy. It's widely used for people who have dementia in the mainstream. It's proven to improve the quality of life as well as slowing down the cognitive decline. It consists of activities that orientate people to the day and time, and also stimulating activity. The orientation to day and time and things like that, and also I guess being present in the moment, as mentioned in mindfulness behaviour, is very helpful to dementia. Is well researched to actually slow down progression, and that dates back to the 1950s, that actually being orientated can help people with dementia. We plan to demonstrate further teaching on how to do cognitive stimulation therapy on our Trust website, possibly through videos. But in the meantime, you can still work with your clients to try and remind them of the day of week or the time of day, talk about things they've done in the day so far. Also doing the activities on YouTube that were mentioned at the beginning of this presentation would go a long way to keeping people with learning disabilities and dementia stimulated. So in summary, although the current situation could result in further decline in people with learning disabilities, there are things that can be done within the home that can help reduce the impact of this. Keeping people with learning disabilities mentally well and relaxed can also help reduce the decline, such as the things that have been presented to you in the psychology presentations previous. The learning disability team are on hand if you require further help, and if you're worried about any presentations that are difficult to manage. Treatments such as cognitive stimulation therapy activities could help, and there may be future videos to help instruct on these. Okay, and there's a few references if you were interested, they'll be uploaded, and a lot of helpful websites that have a lot of information, as well as the YouTube channel. But all the other websites have a lot of information on dementia that could be helpful if you have clients who have dementia. And that's that.